So if you're coming for an IVF cycle, basically we need to plan your stay and everything has to be managed properly. So you should arrive to us between day 2 to day 5 of the cycle. This day 2 to day 5 can be either planned by giving you medications so that you have a planned menstrual cycle, means the date of your menstruation can be predicted. Or secondly, if you're having pretty regular menstruation, you come during that time. Then if you're going to have a fresh embryo transfer, then in that case you should plan a visit for 21 days starting from the first or second day of your menstruation cycle. These 21 days you don't have to stay in the hospital, because in these days you will be called for ultrasound. The ultrasound will be done continuously on a gap of few days. You will be given medications to increase your egg counts so that the eggs can be harvested, they can be taken out. Whenever you are going for ovum pickup and embryo transfer, that time you require a stay for around 2 to 3 hours in the hospital. At the other time you will be discharged. After the embryo transfer, you can fly to your respective place after 72 hours of embryo transfer. Before that, you cannot take a flight. That is very obvious. But obviously if you are going by a vehicle, a car, and the drive is very smooth, you can easily take a drive of around 5 to 6 hours. That is not going to hamper your implantation. And if the male partner is very busy, they can fly back. We can store their semen, but definitely you need to be somebody has to be there for your assistance. A responsible person has to be there if your husband is flying back, somebody whom you can have emotional support. Secondly, if we are going for a frozen embryo transfer, like there is some medical problem or the doctor, we have suggested you to go for a frozen embryo transfer. In that case, you have to break your cycle. So first time you are coming around 14 days, and in the second half you see us and you have to stay around 7 days, means 2 to 3 days before embryo transfer you are coming, because we have to see you if there's anything left we can do for you. And obviously after embryo transfer, after 3 days of embryo transfer, you are flying. So these are the two scenarios in which you have to stay for the IVF cycle, and it's not a very long time and it's not a very taxing time. If you take it positively, then obviously you are investing this for your baby, which is a big investment, and you need to have a planned cycle, and then there won't be any haphazardness, any problem, and the whole IVF journey is going to be very smooth. We care about you.